Hello, my name is Ravel Clements, and this is my Behaviorist Biography project on Dr. Lee Kern. Dr. Kern is currently the professor and director of the Center for Promoting Research to Practice at Lay University in Bethlehem, Pennsylvania. Her research focus consists of positive behavior support, special education, behavior disorders, and ADHD, emphasizing providing interventions for students with social, emotional, and behavior disorders. Her recent work is on a multi-component intervention package for the population of high school students with behavior and mental health issues, adaptations to interventions for elementary age students with mild to moderate emotional and behavior problems, and a parent implemented intervention plan for preschool children with ADHD. Kern has been working with students with emotional and behavior disorders for more than 35 years as a teacher, behaviorist, and researcher. Education. Dr. Kern received her Bachelor of Arts degree from the University of California in Santa Barbara in sociology. She went on to go to get a credential in education, which she was there from 1980 to 1982 at California Polytech State University. She then furthered her education on to receive her master's from Marshall University in special education and on forward to receive her PhD from the University of South Florida from 1990 to 1993. Dr. Kern began her work in 1982, and she went on to teach 3rd and 4th grade in special education at many different locations from 1982 to 1983. From 1983 to 1993, she was a research coordinator and consultant at Hillsborough County Public School classrooms for students with severe emotional disturbance. After leaving, she went on to work as a case manager and educational coordinator for the Division of Child Development and Rehabilitation at the University of Pennsylvania School of Medicine. She worked there as case manager, associate, and assistant. And after moving on from there, she went on to practice at Lay University, where she retained her work as a professor and recently became the director of the Center for Promoting Research into Practice in 2016. So one of the resources that I found just most exciting, most interesting to me was Dr. Kern's book titled Supporting Students with Emotional and Behavior Problems. This is by Dr. Kern, George, and Reese. It focuses on key factors in promoting a healthy learning environment for students in school and promoting positive emotional and behavioral well-being. It consists of 3 tiers which focus on providing these interventions in an education setting. The basis of it is building connectiveness with students to the education system, to school, to kind of lower those rates of disconnectedness. So kids who are often at risk of being out of school for emotional or behavior issues, keeping them on track and building that connectedness not only within the school with the children and educators, but with parents and additional professionals and resources in the community. So Tier 1 includes strategies for all students. Tier 2 includes strategies that are applicable to at-risk students presenting disengagement. So we're looking at those children who are presenting some behavior and emotional issues in school and on track of either being out of school or at risk of not being able to maintain in a normal education setting. Tier 3 includes strategies for students who are already presenting challenging behaviors, disengaged from school, and at risk of dropout. The book also provides assessments or addresses assessments for behavior change, conducting functional behavior assessments, developing an assessment plan, measuring behavior change, and interventions to mental health needs, and developing social skills. Another article that I found was by Serpell, Hyland, Stevenson, and Kern. I found this article most interesting. It's a population that I've worked with in the past, and I find that a lot of times this specific population are not received with resources that they need in order to make a greater impact for change. So this article titled Cultural Considerations in the Development of School-Based Interventions for African American Adolescent Boys with Emotional and Behavior Disorders focuses on the demographic population of African American adolescent boys with emotional and behavior issues and how they represent the majority of the EBD population, which is the population of emotional behavior disordered children or young adults. The article addresses the issues that add to the African American male's overrepresentation in the special education system, and it focuses on gaps in literature, saying that there's not enough research in how young African American males are being affected within the system and where a lot of these issues are stemming from. It highlights issues in assessment for EBDs, saying that a lot of times African American males, because of certain issues or sometimes because of stigma, can be automatically diagnosed as having an emotional behavior disorder. Therefore, we need more research and just more literature written on how to appropriately assess based on these demographics. And it also focuses on the access of appropriate treatment services for African American adolescent boys. Again, I chose this article because it's a topic of interest to me. I contribute my work to be culturally aware and being able to provide information that can help me and others that I'm working with grow, especially in the field where I am very proud to work in and with a demographic that I'm also a part of. Due to the large population of African American males in the field with emotional and behavior disorders, I find it important to be aware of this issue and discovering how to address it further. So a summary of our work. Dr. Kern currently has 2 projects that she has been funded for grant. They're both ending in 2019. The first one is Attain, Advancing Tier 2 Adaptions and Interventions. Kern partners with co-principal investigator Joseph Webby of Vanderbilt University. This project is a 3-tiered system of behavior management, which addresses a variety of students' needs who exhibit various levels of problem behaviors. So again, this focuses on building connectiveness, providing interventions, again, for those students who are already experiencing EBDs, and then those who are at risk of EBDs. The second project is Pathway 360 College Readiness Project, partnered with co-principal investigator Kyle Longritz. This is a college readiness program for high school students. Its principles include assessment of a student's career preference, academic advisement geared towards students' career goals, career exploitation opportunities, and includes a senior presentation related to college and career readiness. Now, though the 360 College Readiness Project states like the very inside the box plan for the college readiness promotion, Attain also focuses on college readiness, but focuses a little bit more on college readiness preparation for students experiencing EBDs within this tiered system. So we're talking about a 2-tiered system that they begin to advance towards a 3-tiered system to focus more on behavior management for children with EBDs. So furthermore, these are my interview questions. I found myself really just wanting to know more about where Dr. Kern's thoughts are moving forward within her work and how she believes we can make a change within the field. So my first question is, what do you believe we as behaviorists can do to provide educators with the tools to work with children experiencing behavior and emotional problems? Number 2, in your opinion, what are educators' greatest challenges working with students with behavior and emotional disorders? Number 3, what can we do to help children and adolescents that may not have been diagnosed with emotional behavior disorders, but still present challenging problems or are at risk of disengagement, removal from school? And 4, with the overrepresentation of African American males in the special education system and with EBDs, what can professionals do to educate themselves and work with other professionals to address the issue? And number 5, I know you currently have 2 projects on your plate now, but are you working towards any new projects that will contribute to further to the field? And again, these questions were very simple basis, but I think that a lot of times we have a lot of research information presented in front of us, and being able to ask a question directly from a researcher or directly from someone who is experienced in the field and see what next steps we can take to educate ourselves and promote more growth in the field is key. Dr. Kern has made contributions to the field of behavior analysis through literature and developmental projects. Her work provides systematic interventions and studies of empirical research and evidence that increase student connectedness and provide educators with resources to meet the needs of students with EBDs. I've learned from Dr. Kern's contributions that creating framework for educators and professionals working with a population of interest is a key component to successful work in the field. That being said, I think that a lot of times in a school system or as educators or professionals, we may struggle with challenging behaviors, emotional, behavioral disorders, especially in the school system, and may not be fully educated or fully aware of how to deal with them. And Dr. Kern is doing research and conducting these projects that put that information out there so that we can learn from it and move forward to how to promote and make a connection from the problem behaviors to promoting a change. And I think that has been Dr. Kern's most influential impact, just providing resources for those people working with children who have these challenges and giving them the information and the ability to make a change and work successfully.